Hello and welcome to the pod. I'm Nathan Fink.
I'm Jolyn Drennan, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today on the show, President and CEO of Prevent Child Abuse America, Dr. Melissa Merrick, joins us to talk family strength, supportive communities, and your role in it. And later, New Hampshire State Senator Rebecca Whitley discusses legislating toward a family-friendly Granite State. New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. This podcast was also brought to you by Family Support New Hampshire. Family Support New Hampshire is NH's coalition of family resource centers and family strengthening programs that exist to ensure Granite State families have access to resources so both caregivers and children can succeed, because supported families are strong families. To find a family resource center near you, visit www.fsnh.org. Hey, it's Nathan, co-host of New Hampshire Family Now. I wanted to take a quick break from the show because it occurred to me the other day that I've never asked you to subscribe to this podcast. Subscribing is free, and when you do it, it helps our placement algorithms, making it that much easier for caregivers across New Hampshire to find valuable information and strategies for their families. Also, you'll be alerted when a new episode drops. And if you like this show, leaving a review helps us that much more. So go to wherever you get your podcast, type in New Hampshire Family Now, and as the kids say, smash that subscribe button. I say click it, because if you smash it, then you're going to need a new one. Thank you and enjoy today's podcast. Hello and welcome to the podcast. Today in the show, I have
I'm here. I'm here.
We have the great pleasure of welcoming President and CEO of Prevent Child Abuse America, Dr. Melissa Merrick, whose tremendous work with the National Center for Injury Prevention and Control at the CDC and U.S. Department of Health and Human Services Office of Child Abuse and Neglect has laid the foundation for a new initiative, Thriving Families, Safer Children. Dr. Merrick, welcome to the show.
Thanks for having me.
Before we get into PCA America and all your wonderful work in primary prevention, I always ask Jolyn about our family, and I know you have 2 young children. So how's your family doing, and what are you guys working on?
My family's doing great. I have 2 kids, a 13-year-old daughter and a 10-year-old son, and I have a dog and a husband, and we are just, busy scheduling and rescheduling all the, trips that we have to make this summer, camps, and getting grandparents in town so that we have childcare. So all of the normal juggles that I think everybody's doing, but we are healthy and we're happy. So thanks for asking.
Great. Well, I know PCA America turns 50 this year, an incredible length of time in which I'm certain your organization has adapted to meet its vision of a future where no child is ever abused or neglected. So how has PCA America changed over the years? And what are some of the new efforts that you've embraced so to create safe, stable, and nurturing relationships and environments?
Yeah, I love that question. And I think PCA America is no different than the field at large, right? We've changed in so many ways. I think early in our infancy and the field's infancy, we really were raising a lot of attention to the problem of child abuse and neglect, really focusing on maybe secondary and tertiary prevention. How can we focus on early identification and, triage to services? And I think the whole field has really built an understanding of the strong evidence base on a public health approach, on how we can actually get in front of early adversity before it occurs, when we focus on the conditions that families need and children need to thrive. So now I think we are excited that in 50 years, we are now really about raising awareness and commitment to the prevention of child abuse and neglect, to the primary prevention. What are the things, the systems, the policies, the community services and supports that we need to help families before they find themselves in crisis. So it's a really important shift. And I think that is not unique to PCA America. America, although we are really in a great place in 50 years through our nationwide state chapter network. We also have a nationwide evidence-based home visitation program called Healthy Families America that's in 600 sites across the country that's celebrating its 30th anniversary this year. And then, of course, policy and advocacy at the federal and state level and communications and research and just all the things. We're really, really excited about the next 50 years of this work as well.
Yeah, and I did mention this in the intro, the Thriving Families, Safer Children initiative, because obviously as your organization kind of reflects and changes over the years, you come across and invest in different initiatives like this one. So can you talk a little bit about Thriving Families, Safer Children and why it's an exciting direction to go in the 50 years to come?
Absolutely. It's a really exciting first of its kind of national movement, if you will, where PCA America is one of 4 national partners. The others are Casey Family Programs, the Annie E. Casey Foundation, and the U.S. Children's Bureau. So kind of child welfare for our government. But what's unique here is that it's not sort of a top down, like these national partners are going to tell communities what to do. This is an intentional shift in, again, that transformation that we're looking for. How do we help families before they're in crisis, right? Right now, child welfare has to wait often until families are really in great need and crisis to access services and supports that had they been able to access in their communities easily before they were in crisis, it could have prevented a whole host of traumas and separations, right? But the way we're doing it is by intentionally co-creating this movement alongside people with lived expertise. So, it doesn't matter what fancy degree you have or whatever, you don't know the opportunities in a specific community and the challenges, right? But people that live in those communities have that expertise and their voice is so critical here. So this is really about race equity being at the center of anything we do as a country in prevention. And also, again, that co-creation of the prevention solutions. Because again, what might work in my neighborhood in Chicago may be really different than what would happen in New Hampshire or around the country. So really involving those experts that really have been through the child welfare system or have stayed out of the child welfare system because they had other supports and services in their community that they were able to access when they needed it is so exciting about this new Thriving Family Safer Children initiative.
Dr. Merrick, so within our team at the Children's Trust, we often talk about the invisible nature of primary prevention and how it involves like investing in future outcomes to influence current behavior and conditions. But the work of preventing child abuse and neglect is data driven. So can you talk a little bit about what the data tells us in preventing child abuse and neglect?
Such a great question. And, as a scientist, I spent 10 years at CDC. We're always thinking about what can you measure, right? And so prevention is also really difficult sometimes to articulate because you're like, it's the absence, like you said, of the bad things, right? That we're used to counting and talking about the prevalence and incidence of these kinds of bad things. But how do we boost the good things that we know then will realize multiple health, well-being, and prosperity impacts and goals, right? So I think overall, the data are really clear that prevention is possible. So that's number one. I think CDC has a lot of great tools for us to draw from in terms of the evidence base on what are the particular buckets of strategies, right? Like we know economic supports for families is such a critical one, not just at preventing child abuse and neglect, but preventing intimate partner violence, preventing suicide risk, preventing a whole host of violence, perpetration, and victimization outcomes. So, in terms of the data for those, it's things like, every dollar increase in minimum wage really has impacts of reducing child neglect by 10%. I mean, these are measurable. These are across states that, again, $1 increase can reduce child neglect by 10%. There are other factors like this too. We know paid family leave, right, has been able to prevent abusive head trauma among infants. So there are real data outcomes, measurable, RCTs and studies that really help us know about that. And that's just around economic supports for families. We know norms change, right, is another core component. It's getting away from the dominant narrative that it's that bad mom or that poor family that maltreats kids and really recognizing, we all have a role to play in keeping children healthy and thriving and strong, but also that all parents need support sometimes, right? None of us do this parenting job alone. It doesn't matter. I have a PhD in child psychology. I need all the resources too, right? And maybe my family, we may need different resources than another family when the burdens are so heavy, but all of us have that heaviness on us and need each other. So I think norms change is another bucket of strategies. The other one is, providing support for new parents around positive parenting. So this is where evidence-based home visitation has lots of impacts, right? And so just even speaking about the one I know the best in Healthy Families America, which is PCA America's signature evidence-based home visitation model. But not only does HFA reduce child abuse and neglect and intimate partner violence, but it also improves economic self-sufficiency for parents. So among teen moms who graduate from HFA, they are 7 times more likely to complete 1 year of college than moms that are not in the program. I mean, that's a huge transformational impact on generations to come. And then, of course, there are strategies around parenting programs and helping mitigate negative health outcomes once adversity has occurred, right? I would call that more secondary or tertiary prevention. But I think what the field is clear about, prevention is possible, but also we need these comprehensive approaches to prevention. You could have the best evidence-based program, but if you are a parent who doesn't have transportation or has to work 3 jobs to put food on the table or, whatever, you have all of these extra challenges, the context makes it so that best evidence-based program cannot have maximal healthy impacts on your family, right? So it's around recognizing that we need both and. We need primary prevention and secondary, tertiary prevention and trauma-informed systems. And we need that comprehensively across sector, involvement in this work. It's no single entity that's job it is to prevent child abuse and neglect. It's all of us, and we all play multiple roles. But really, for me, it's that the data are super clear that prevention is possible.
Jolene, I just want to jump in because I'm terrible at not jumping in. And I can hear this in your voice, Dr. Merrick. Prevention is exciting. And before I got into this field, I had this moment of what does that look like? And I'm coming to find it is exciting because it's based on upward mobility. It's based on strengths. It's about moving to a space where I aspire to be. You know what I mean? And so when we talk prevention, we're talking about action. So I really appreciate the way you talk about this.
I love that. And I also have trouble not jumping in, so I hope it's okay. But, I share, yes, you hear that excitement in my voice, and I hear the excitement in your voice and the energy, because for me, this is about celebrating what is possible, right? So we know that prevention is possible. Let's celebrate that possibility. Let's be joyful and hopeful and really use our data-informed strategies to really better the next generation, right? We all want what's best for our own kids. And I believe that we don't always share that same desire for everyone's kids, but the data are also strong that my children will do better if all children are doing better, right? So it's really this whole of society approach. And, in your video tools around, families and joy in New Hampshire and just the power of prevention, it's so palpable how we all have a role to play. And so it is action oriented. It's not about learning about the data and it's passive and academic. No, these are about people's lives. And especially in this time of parenting during a global pandemic and during a time that has just been really, really heavy for all of us. But for many of us in particular, it's just a time to recognize that we need each other and that we're actually stronger together. And so, yes, I think there is just so much joy and hope and possibility in prevention.
I agree. I mean, that's why I'm in this field. I moved from, an intervention clinical position to primary prevention. And really, it is really exciting to see what is possible here and what the work that's going on in New Hampshire. And I think a lot of the times where we bump up against resistance is really around when you have to advocate for the dollars to support this kind of work. So oftentimes when we're looking at the systems level change to ensure their conditions are right for thriving families, it also seems to be like a living room issue. So I guess to your mind, what does prevention of child abuse and neglect look like at the, neighborhood and home and relational levels?
Yeah, it really looks like all the things that you portrayed in your video, right? Like it's about community and celebrating together. It's about neighbors helping each other out. I'm thinking about specific examples protocols around this time of physical distancing, like I got sick and I didn't have COVID, but I was sick and a neighbor just cooked a meal and left it on my front porch. I mean, that was such a help, right? It was such a, oh my gosh, I don't have to like figure out what I'm going to do tonight with, not feeling well and having all these other stressors and still working full time and all of that, kids are virtually learning. I mean, it was chaos in my house. I'm sure it was chaos in lots of people's houses, right? But recognizing that simple connection, knowing that someone sees you, that someone is here for you, that I don't always have to ask for the help. I mean, I think we could do better asking for help as people, but there's a lot of stigma, right? And that like, gosh, why do I have to ask for help? Other people seem like they don't need help. So taking that step away and just anticipating that we could all use, a meal or some cookies or a friend or a phone call, a phone call in this time of Zoom and virtual meetings, just a simple phone call sometimes can really make the difference for families and for parents who just, we're doing a lot. We're doing all the things, right? And so I think prevention is as simple as that. It's also about, as a country and as a society, making sure that families have access to what they need, when they need it, right where they live, provided by people who look and feel like them and are not going to be perceived as judgy or I think that is what we mean about equity too, right? That is one way that we demonstrate equity, is making sure families have what they need when they need it and before they're really in crisis. So I think prevention can be small things and very big things, and it really needs to be all of those things. When I'm on the Hill, I was on the Hill with my team last week, talking to elected officials, really around a more robust funding stream for home visitation, for example. But really, it's about this family stories, right? I think that is really concrete for any legislator, no matter what side of the aisle or whatever your beliefs are, hearing directly from families about how stressful this time is, but also how helpful prevention supports can be. Relationships make the world go round, right?
Yeah.
So having more relationships to draw on, safety, stability, nurturance, we know that these are critical protective factors. And again, that when we have those at every level in a community, that it's effective.
Actually, it makes me think of adverse childhood experiences as well, because not only might you have an aversion to help seeking, but there are members of the community that might not be able to actually talk about those things, or those things happen in an early developmental stage. And I'm curious to know, how can we better prepare our environment, either in the community or our systems, to create those safe, stable, and nurturing relationships environments in light of adverse childhood experience?
Yeah, it's a really complementary question to what we were just talking about. We all need help sometimes. And as someone who led the science portfolio of adverse childhood experiences for CDC for many years, I can tell you that ACEs are super common and they're everywhere, right? So we can assume that most people have experienced adverse childhood experiences of some sort, right? About 2/3 of any community. And then in some communities, even higher numbers. So then why do we need to really measure more about how many ACEs are in this community, as opposed to what do we want to do about it? What do we want to have in place to help support not only the mitigation of negative health outcomes from those ACEs, but also the prevention of the next generation from having as many ACEs, right? So these are about those concrete supports in communities, right? Family resource centers in communities, home visitation, access to food pantries and diapers. I think during the pandemic, it was like data, diapers, and devices, right? Were like the stuff that I think our communities really needed in a big way. So really, again, we know what those services and supports could be. We know the power of having those without being court mandated to take parenting classes or being, referred to this service, but just this availability and accessibility of these things in a community could really set our entire community on trajectories toward health and well-being, not just individual families. So I agree. I think it's about how do we transform our system to make make sure that we can have those things available and accessible for families in a real way. It's also about having high quality, affordable childcare and having these, business level policies like on-site childcare or paid family leave and sick leave, right? That again, have data that we know can help prevent child abuse and neglect and other adversities. So I think that this is about the next wave, the next generation of this work. And I'm always going to be about measurement. It's not about measuring like another bad thing that's associated with ACEs. It's about understanding that ACEs are prevalent and they impact our health and well-being. So what are these prevention solutions that we need more accessible and readily available for everyone?
Yeah. Dr. Merrick, it was wonderful to have you on the show today. Thank you so much for being here and all of the important work you do. I'd love to have you back in the future if we can.
Oh, I loved it. Thanks to both of you. What a fun conversation.
To learn more about PCA America and all their important work, visit preventchildabuse.org. Again, that's preventchildabuse.org. And when we come back, State Senator Rebecca Whitley joins us. Don't go anywhere. Many thanks to New Hampshire's Office of Social and Emotional Wellness for sponsoring this podcast. Started within New Hampshire's Department of Education, the Office of Social and Emotional Wellness consolidates policy development and implements projects and programs that are focused on health and wellness with an emphasis on behavioral health of all students, youth, and families. To learn more about the Department of Education and its many programs and approaches, visit www.education.nh.gov. Today's show was also brought to you by Merrimack County Savings Bank, who proudly supports the mission and efforts of New Hampshire Children's Trust. Founded in 1867, Merrimack has served people, businesses, nonprofits, and municipalities in central and southern New Hampshire for over 155 years by treating everyone with care, respect, and compassion. Visit your local offices in Bow, Concord, Kentucky, Hooksett, and Nashua, or go to www.themerrimack.com. New Hampshire Children's Trust is excited to announce the launch of the 2022 I Am Prevention campaign. Throughout April, the Trust and its many family supporting partners are celebrating the many ways to strengthen families and help caregivers provide safe and nurturing environments for children. Connect with us for a list of trainings, webinars, panel discussions, and more, all designed to build family and community resilience in which children can thrive. Visit www.nhchildrenstrust.org to be prevention today. Hello again and welcome back to the podcast. I'm incredibly excited to have with me, and just me, Rebecca Whitley, New Hampshire State Senator from District 15. Rebecca, welcome to the show.
Thanks for having me.
This is your first term. Am I correct in that?
It is. Yep. So I'm in the middle of the second year of my first term. Yep.
I'm curious to know, what is something that surprised you about your role as a state senator that you might not have been privy to otherwise?
That's a great question. I came to politics on kind of a roundabout route. It's not something that I ever envisioned for my career. It wasn't a lifelong goal, but I think when this seat opened up, I kind of looked back on my career and looked back on, the skills that I had developed in litigation and system change through that avenue, through just grassroots advocacy, how that can move change, and then how actual policy at the legislative level can make change. And so I saw, getting into the Senate as sort of the next phase of that. What's another way that I can make change, that I can improve lives? And in particular, something that I care deeply about is improving the lives of children and making sure that every child has the opportunity to grow up healthy. So I went into the Senate with that goal. And I think I expected everyone who gets into politics to sort of be mission driven on a particular issue. And I think that's not always the case. I think people get into politics for different reasons. And so once I learned that, I think I was able to better navigate certain relationships and, identify what drove other people. And I think once you know what motivates people and you can be successful and, perhaps persuading them to the issue that you want them to vote on. And also recognizing that every senator, like there are 24 of us, we all may have very strong and divergent views about certain issues, but at the end of the day, we are all just people, right? And so, I sit next to Republicans and I sit next to, older folks, younger folks. And I think it's important that we both look at each other like humans and people and connect on that issue before we do anything else. I'm a mom. I love my son. I know that other people love their children. And so that's such a great way to connect.
I'm curious how you wear that parent lens or hat in the state Senate, because I mean, that's a hard one to take off.
It is something that I never take off. I think early in my career, before I had children, I was a lawyer and I really separated my personal life from my professional life. But when I became a parent, I realized that I just couldn't do that because my son and my family is my number one priority. And so now, because I don't separate it, I feel like it helps me. For example, I have always loved children. I have always advocated for children on a professional level. But when I had my own son, and maybe other people experience this, but I had just like a deeper layer of empathy, both for children and for other parents. And so I try to take that lens into the Senate, thinking through like, okay, this is what I know what it's like to be a working mom right now. This is how it feels to navigate getting your child to school and then turning around and trying to go to work, or navigating, well, where is my kid going to go after school? I don't have childcare. Or navigating the issue of, how do I both, save for college and have a fulfilling career? So I would say that I never take that lens off. It is with me every step of the way. And I think it's even more important now as an elected official to bring that lens to the Senate, because if you look around at the state house in New Hampshire, there are not a lot of younger parents.
Yeah. At times I think it can feel like these efforts or this sometimes legislation comes in like a call and response like manner, right? The call being, here's a challenge that's upon us. How do you view New Hampshire's legislative body, so their role in preventing challenges rather than, say, intervening post-challenge or after the problem has occurred?
That's an excellent question. In New Hampshire, we do have a tendency to operate from crisis to crisis. And, you're describing it as a call and response, but it is the case that, and I think it's because we're such a resource scarce state and we run on this scarcity mindset that we only go to the crisis and deal with it then. But I think that is the wrong way to legislate. It's not smart. And if you look at that, is it even fiscally smart to do that? And I would say no, that it's way more expensive to deal with a crisis when it is a crisis rather than turning around and, thinking about prevention. But it does take some thought and it does take coalition building. And I think in New Hampshire, because we have such a large citizen legislature, it is hard to do that long-term thoughtful planning, but it's possible. And I would say, this session is evidence to that. Backing up a few years, we have experienced a significant children's mental health crisis where children are not getting appropriate support and they are ending up in crisis in our emergency rooms. About a decade ago, we started identifying solutions to prevent that. And we had to start at the crisis level because, of course, we cannot let our babies wait in the emergency room. But now we are at a place where we have identified how to deal with that crisis. And we are now starting to look at the prevention side of the equation. And I think we are also doing that on the primary prevention for abuse and neglect. I think we have leadership in state government that understands the importance of prevention. I think there has been so much work in the advocacy community to educate legislators about the importance of primary prevention. So we're getting there. We're not where we need to be, but we're getting there. And I think yesterday, actually, in the New Hampshire legislative session, we passed a bill that I had worked with advocates to introduce, Senate Bill 444. And it took the children's system of care, which we had been working on for a long time, and it switched the focus to the prevention side. And we are able to look at young children and families about how to meet their needs early on the primary prevention side. And then also, if there is some sort of trauma, how to mitigate the impacts of that trauma. And when these children are very young, how do we support the family to mitigate the impact of the trauma long term? So we're getting there. I continue to have hope because it is a bipartisan issue and they know it's the right thing to do. They know it's that we have a moral obligation to support our children, but they also know that it's the smart policy.
Now, if somebody hears about these things that you're working on, how does a person like me who really doesn't know quite what to do, how can I get involved to get some of these efforts that you're working on over the finish line?
always welcome, someone just picking up the phone and calling me or emailing me. All my information is online. So just having a conversation, I care deeply about, this issue. Can I help? The other thing is in New Hampshire, we have incredible nonprofits that do a lot of advocacy. New Futures, the Children's Trust, and so many more. There's a New Hampshire Hunger Solution. So there are a lot of nonprofits that help people elevate their own voice. And a lot of the work that they do that I really value is helping people to share their story about why particular policy issues are important to them. And that's incredibly moving at the State House. I will say when I was an advocate, when I, worked with a family to come in and share their story about, why access to a certain service was so necessary, that's when legislators paid attention. Lobbyists wear these orange badges and their input is important. But I think when someone comes to the State House and shares their story, it's so powerful. And, now I'm sitting behind the table, listening and hearing, I continue to feel as a legislator now, being on the other side of the table, that hearing directly about their stories is still so impactful.
Every time I find out that someone is a parent, I always have to ask about unsolicited parent advice. So what is the best unsolicited parenting advice you've ever gotten?
I love this question because people are so free with their advice, right, to parents. But one thing that really resonated with me is that, our job as parents isn't necessarily to mold our children. I think there's this old idea that, our children are the clay and it's our job to sort of mold them into who we want them to be or who society wants them to be. But what I realized is that children come out who they are. And in a lot of ways, we just have to get out of the way. I have a very strong-willed, bright, rascally child. And, I go back and forth every day about how to just, he has to be a functioning member of society, but also he's a beautiful spirit who I just want to, shepherd through life. So I got some advice, don't mold your child, just sort of walk beside them and shepherd them through life.
That's great advice. And, now that I think about it, the things that frustrate me most about right now, both of my sons are the things I actually most admire about them and wish I were. Senator Whitley, thank you so much for taking the time today. I know you're busy, and it's been a pleasure to watch you in the legislative body. Please come back whenever you have time.
Thank you very much.
To learn more about Senator Whitley and her many platforms, go to www.beckywhiteley.com. Again, that's beckywhiteley.com. Many thanks to the Samuel P. Hunt Foundation for sponsoring this podcast. Established in 1951, Samuel P. Hunt Foundation is a Manchester-based, independent nonprofit that provides grants primarily for the arts, children and youth services, faith-based organizations, educational institutions, healthcare, and human services. Today's show was also brought to you by the Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy and Protection Program, a multidisciplinary program with the Children's Hospital established to evaluate and provide integrative care to suspected victims of child maltreatment. Together, a team of physicians, advanced practice registered nurses, social workers, nurses, and child life specialists work to provide consultation and evaluations of children who are suspected victims of abuse, so to serve in the best interest of children and families at multiple levels of prevention. For more information about Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy Protection Program, visit www.chadkids.org/child-advocacy. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.